Hi, my name is Christine Marie Monge, and we're going to discuss about substance, medication, misuse, and abuse among elderly. The Group 5 members are Christine Marie Monge, Catherine Bedrillo, Maya Balan, Robin Hughes, and Ressa Sheikh Mele. Our learning objectives for this topic are: number 1, define medication or prescription abuse and misuse in elderly. Number 2, identify the prevalence and demographic rate of substance abuse in Ontario. Number 3, define substance abuse and identify its type. Number 4, identify the predisposing factors of substance and medication abuse, misuse among elderly. Number 5, identify the signs and symptoms of substance abuse and misuse. Number 6, identify barriers of medication abuse and misuse. Number 7, identify the treatment plan. And number 8, identify preventive measures and strategies to medicate. Substance abuse, particularly of alcohol and prescription drugs among adults 60 and above, is one of the fastest growing health problems facing the province. Because of insufficient knowledge, limited research data, and hurried office visits, healthcare providers often overlook substance abuse and misuse among older adults. What is substance abuse? Substance abuse refers to the harmful or hazardous use of psychoactive substance, including alcohol and illicit drugs. Psychoactive substance can lead to dependence syndrome, a cluster of behavioral, cognitive, and psychological phenomena that develop after repeated substances. That includes strong desire to take the drug, difficulties in controlling its use, persisting in its use despite harmful consequences, a higher priority given to drug use than to other activities and obligations, increased tolerance, and sometimes a physical withdrawal state. What is prescription drug abuse or misuse? Prescription drug abuse is the use of prescription medication in a way not intended by the prescribing doctor. Prescription drug abuse or problematic use includes everything from taking a friend's prescription painkillers for your backache or snorting or injecting a ground-up pills to get high. There are a lot of factors that allow people to get into trouble using these drugs. Number 1 is frequent prescribed medications are usually a candidate for misuse and abuse. Number 2, hyperalgesia. Number 3, different pain threshold. Number 4, higher level of personality. And number 5, social-emotional. Number 6 is physical. Under physical is a compromised mobility and dexterity. According to the study of opioid-dependent patients admitted to the Center of Addiction Mental Health in Toronto, 37% reporting who are receiving opioids solely from the physician prescription, 26% from both physician and the street, and 21% from the street alone. General population aged 15 and above, according to the 2013 Canadian Tobacco, Alcohol and Drug Survey, the rate of past year use of opioid pain relievers among general populations was 14.9%, down from 21.6% in 2008. Cannabis use by Ontarians aged 50 years and above has increased significantly from 1.4% in 1998 to 4.6% in 2007. And 6 to 10% of older adults who are drinking will experience problems. The prevalence rate of seniors 65 years and above, the rate of opioid pain reliever among all Canadian seniors was 16.2% in 2013. In aging population, the proportion of those aged 65 years and above has almost doubled in the last 50 years, from 7.7% to 13% in 2006 and 13.6% in Ontario. The demographic and prevalence rate in Ontario has a significant upward trend in the past year. Alcohol use by those who have 65 and above, from 58.5% in 1997 to 73.5% in 2007.
few types of medication misuse and abuse that can be seen among the older adult population. The first one being prescription and over-the-counter medications. Older adults use prescription drugs nearly 3 times as frequently as the general population, and they also purchase nearly 3/4 of all of the over-the-counter drugs. Medication misuse includes taking extra doses, failing to fill prescriptions, misunderstanding the physician's instructions, missing doses, taking medication at the wrong time, and stretching out medications to make them last longer. The elderly are at particular risk of unintentional medication misuse because of the simultaneous use of multiple medications and the sensitivity to their effects because of the aging process. As the body ages, there are physiological changes in digestion as well as liver and kidney function that impact the way medications are absorbed and metabolized, creating a greater risk of physical and mental damage. The most common misused and abused prescription and over-the-counter medications include opioids, such as oxycodone, benzodiazepines, such as diazepam, barbiturates and non-barbiturate sedative hypnotics, and central nervous system stimulants. Many of these drugs have a huge abuse potential because of their addictive qualities. Even when some of these drugs are taken as prescribed, there's a danger that tolerance dependence and toxicity may develop. The second type of misuse and abuse that can be seen in the elderly population is alcohol abuse. Although alcoholism usually develops in early adulthood, the elderly are not exempt from alcohol abuse. In fact, a recent study in the US indicated that between 1.1 and 2.3 million elderly citizens use alcohol to alleviate grief and loneliness. And doctors may tend to overlook alcoholism when evaluating elderly patients and just attribute the signs of abuse to the normal effects of the aging process. Alcohol also affects the older adult differently. People who maintain the same drinking patterns as they age can easily develop alcohol dependency without realizing it. It also takes fewer drinks to become intoxicated, and the older person's organs can be severely damaged by smaller quantities of alcohol than the younger adult. Also important to note is that the combination of alcohol and over-the-counter medications is the most common source of adverse drug reactions in the elderly. The third type of abuse seen in the elderly is illegal drug use. Although this form of abuse is not as common as the other two discussed, it is on the rise among the elderly. Illegal drug use can be divided into 2 categories, the first one being early onset, whereby drug abuse started in early adulthood and continued on through older adulthood. The second category being late onset, which is far less common, and it's when the abuse started as an older adult, essentially. Causes of this, for example, might be painful medical conditions that push the elderly towards self-medication. By far the most common illegal drug use is marijuana. Cocaine and heroin are less common, but they do exist. The older adult that abuses cocaine and heroin are at very high risk of physical decline that could result in disability and premature death.
Hi, my name is Catherine Vidrio, and I'm going to report about the barriers to substance abuse and misuse. Another thing that I'm going to report is about the treatment options for patients who have substance abuse and misuse. So now I'm going to report about the barriers to substance abuse and misuse. Providers working with older adults, including primary care physicians, often miss substance abuse and misuse. They don't know that substance use problems affect 15% or more of the elderly patients that they serve. Some providers refuse to see substance abuse as a real problem among older adults, and therefore they do not view treatment as an important success for this population. Even if providers are aware of the need to look for signs of substance abuse and misuse, they often lack the professional training or skills to recognize them in the older population. Signs and symptoms of alcohol abuse and misuse are similar to other common medical conditions and to what is often mistakenly believed to be part of the normal aging process. Signs and symptoms of alcohol abuse and misuse are similar to those of other common medical conditions. These symptoms are memory problems, fatigue, sleep problems, confusion, depression, anxiety, irritability. Some of the elderly who misuse drugs and substance abuse, they show signs and symptoms that includes mood changes, irritability, lack of energy and concentration, loss of short-term memory, and general loss of interest. These symptoms are usually seen in patients who are abusing different kinds of drugs. Common documented barriers to services are: first, transportation, homebound older adults, shrinking support systems, lack of expertise in this field, financial matters, age-related economic issues, physical barriers to care, gaps in services, inadequate financing, fragmentation of services. These barriers are usually the common causes of substance abuse among elderly. There are other treatment options for patients who have substance abuse. These medications are commonly prescribed for patients who use drugs and alcohol. The most common drug prescription for these elderly are: first, disulfiram. Disulfiram is a acetaldehyde dehydrogenase inhibitor. It is reported to be limited in the elderly due to their higher risk for adverse cardiovascular events, which is caused by alcohol and acetaldehyde toxicity, and disulfiram, which is induced by hepatotoxic toxicity. The second drug is naltrexone. Naltrexone is a long-acting opiate antagonist that appears safe and effective in the elderly. And it also decreases craving. It also increases the time to first drink, and it increases the time to heavy drinking once patients with alcohol dependence have their thirst to drink. Side effects of naltrexone are nausea, headaches, anxiety, and in rare cases, it causes liver damage. Acamprosate is a glutamatergic medication. It is a FDA approval in abstinent drinkers. It is also an anti-craving agent in patients with alcohol dependence. It is also significantly greater rate for treatment completion because of the abstinence rate and or cumulative abstinence duration compared to placebo. Topiramate. Topiramate is an anticonvulsant medication that reported some success in initiation of abstinence of alcohol. It causes cognitive slowing and blunting in elderly patients. Ondansetron is a 5-HT3 receptor antagonist. It decreases alcohol use in early onset of alcohol substance abuse in elderly. It is also prescribed for alcohol-dependent patients, which is very, very common prescribed medication for elderly people. The next medication is mirtazapine. Mirtazapine also shows an increased success rate for patients who have alcohol detoxification.
Hello Joyce and class, I am Maya Balan and my topic is to discuss about the different types of screening tools and treatment for substance abuse. I am going to discuss first regarding the different types of screening tools used for detecting alcohol abuse. First one is the CAGE, which is known as cutting down, anode, guilty and eye opener. The next one is SMART screening tool, and there is a geriatric version of this SMART screening tool, which is known as Short Michigan Alcoholism Screening Test. Then we have audit screening tool, which is known as alcohol use disorder identification test, and lastly NIDA drug use screening tool, which is a one question quick screen, as well as the full NIDA modified alcohol and substance abuse screening test. And my next topic is regarding the treatment of substance abuse. The main aims of treatment should include the following: stop using the drug, stay drug free, and be productive in family, at work, and in the society. The treatment options include psychosocial, cognitive, behavioral therapy, motivational interviewing, supportive and non-confrontational approach, alcohol anonymous, and detoxification. And there are lots of medications used to establish normal brain function and decrease cravings. Then medications for withdrawal symptoms and preventing relapse and co-occurring conditions. Then we have nicotine replacement therapies are available in the form of patch, spray, gum, and lozenges. Approved medications for alcohol addiction are naltrexone, acamprosate, and disulfiram. Next, I am going to discuss about the needed actions. Actually, needed actions are important as the number of older adults with substance abuse problems grows. So it is at most important to mobilize resources and prepare for the significant input that growth of the aging population will have on our mental health and substance abuse developing systems. So the main important needed actions are improving access via increased service capacity and offering services in home and community-based settings, improving quality of care, integrating substance abuse, health and mental health and aging services to provide comprehensive care, building a clinically and culturally competent workforce through education and training of providers, increasing support for family caregivers by education about medication management and signs of abuse, providing public education to address ageism, stigma, ignorance, and fears about treatment and its effectiveness, improving research on effective prevention, intervention, and recovery support strategies, designing finance models that support best practices, integrated service delivery, parity, and incentives, and finally, developing governmental and private sector readiness, including leadership planning and program development. Okay, thank you for listening to me.
Hello, my name is Raza Sheikh Ismaili. I want to talk about prevention for abuse and misuse of medication in elderly. So first, I'd like to let you know that prevention strategies for older adult substance abuse and misuse need to take into account that the usual distinctions between primary, secondary, and tertiary prevention are a poor fit with the patterns of substance use and health problems already present among seniors. Well, in contrast to alcohol abuse patterns, today's elderly are more likely to encounter problems with prescriptions misuse and those in other age groups. About 80% of older adults have some chronic medical conditions. So they use medication much more than other age groups like younger people and kids and children. So as long as they are use more medication and they have some maybe aging related issues, they are more encounter with abuse and misuse of medication. They already receive from 25% to 30% of all prescriptions and use these drugs at a rate as much as 2.5 times that of younger people. So there are some plans and also targets for preventing elder people as far as medication use and abuse. The targets for prevention of elderly substance abuse and misuse should be multiple one, including older persons themselves, and not only themselves. There are other groups and people that they need to be educated as far as misuse of medication for older people. like the physician and other healthcare provider. And they need to be aware about this topic. If a physician knows and have enough information about this topic about his patient, while he continues and monitor much more than other patients as far as misuse and abuse of medication for this group age. Family members. So mostly elder people, they are living with other members of the family, while other family members, they need to monitor the older people as far as medication and any other drug misuse and abuse. And voluntary organizations, well, as you know, there are a lot of organizations nowadays. They are helping and monitoring older people, so they need to be aware about this topic, about this group of age and general public. So well, policy and general policies and programs from government and other healthcare organizations, they need to be aware about this and make some plans for this group. There are some recommendations for this topic: involvement in program design of senior services and other interested agencies. Strategies for consideration may involve the use of existing materials to compile a research information package for widespread distribution. And the last one is education. The last one and the main topic is education and training for elderly people and their family and providers, healthcare providers, and as I mentioned earlier, all those people that they are related with older people, all of them, they need to be educated and improve their knowledge and information about this topic is very important. Thank you very much and have a